In this video, I will share what I think is the main driver of the extremely high healthcare costs in the US. To illustrate, consider a procedure that would cost $1,000 in a free market. At this price, say 2 million people are willing to purchase this procedure. Then the total cost to the country is $2 billion. $1,000 times 2 million. Now suppose that people only needed to personally pay $100 and others will pay for the rest of the cost. Then, at the lower price, more people would opt for the procedure, say 3 million people. This increases the cost to the country to $3 billion. In reality, however, the cost to others wouldn't just be $900. Since there is now a higher demand for these procedures, the price will increase. Also, since the patient's personal spending is capped at $100, they have no incentive to shop around for the best price. The cost to others will rise even more, say to $1,400. This brings the total bill to the country to $4.5 billion. Note that now people will buy the procedure when it's only worth $100 to them, even if it costs others nearly $1,400. Consider the empirical evidence. Dr. Amy Finkelstein, a health economist at MIT, has written, quote, "Between 1950 and 1990, real per capita medical spending increased by a factor of 5. Over the same period, the average co-insurance rate for the population as a whole fell by 50 percentage points." End quote. Note that health spending, even when adjusted for inflation and population growth, still increased 5-fold over those years. At the same time, the co-insurance payments, meaning the personal out-of-pocket payments people made, saw a dramatic fall. Dr. Finkelstein writes, quote, "A back-of-the-envelope calculation based on the estimated impact of Medicare suggests that the overall spread of health insurance between 1950 and 1990 may be able to explain at least 40% of the increase in real per capita health spending over this time period." End quote. Health economist John Goodman has written, quote, "Fundamentally, we cannot get off the current spending path unless someone is forced to choose between health care and other uses of money. Someone must be willing to say that one more MRI scan, or one more blood test, or one more physician visit is not worth the cost, that the money is better spent meeting other needs." End quote.